And you mentioned some of these already. There are already approved tools that can quantify immunohistochemistry, detect cancer on slides, flag metastasis and lymph node resections, things like that. For practice from the practicing oncologist perspective, which of these tools are actually making a huge difference in real world workflows? Because some of them sound like they're still in kind of like in the conceptual phase, and then some are being used heavily. From your perspective, what's really making a splash?
I could give you a shorter answer or a longer
Give
answer
me
to
the
this.
long answer.
Okay. I think we should talk about really what we see in radiographic imaging, pathology, and maybe clinical AI separately. So the radiology sort of AI tool started with what we call computer-aided diagnosis, which were less of these deep learning models and more image recognition approaches. And computer aided diagnosis has served as a second reader to mammograms in the United States since the, I think, early mid 2000s. And these earlier approaches had some sensitivity for cancer detection, but there have been several studies of many of those early mammography models that found that led to an increase in number of biopsies, potential inaccuracies, and they weren't adopted worldwide. It's kind of just regional differences in practice, but they were in the background in our practice even for, you know, probably 10, 20 years for patients as they were getting evaluated for breast cancer screening and breast cancer diagnosis. Uh, what we're seeing in the last perhaps 5 years or so are the replacement of these more crude image analysis techniques with artificial intelligence algorithms that are trained on millions of mammograms and can actually improve on the performance of what trained breast radiologists can do. And what's really exciting is this year we saw the first approval of a breast cancer risk prediction tool directly from mammography. Now, we know that there are mammographic features that predict breast cancer risk, including breast density, but I think it's very futuristic to just imagine AI models learning the features associated with risk from this analysis of millions of images, things that we probably couldn't pick up on with our naked eye, and use that to be able to identify patients who are more at risk, and then perhaps intensifies the frequency of screening and lead to more early diagnosis and more cure. And so these tools are still in I think the AI assessment of mammograms for just a diagnosis of suspicious lesions, they are in practice and are affecting patient care. The risk assessment stuff is something that's on the horizon, and I think we will see in the near future, but that has the potential to do better than our current practice, and I think that has a lot of promise.